If you are over 65 years old, this is an urgent warning. Medical data now shows that joint pain and stiffness more than double after age 65. Not slowly, not gradually, but rapidly. Within just 5 years, many seniors go from mild knee discomfort to struggling to stand up, avoiding stairs, giving up daily walks, and eventually relying on pain medication or surgery. And here's the frightening part. Most seniors believe joint pain is normal aging. It's not. It's often the result of silent inflammation, destroying your joints from the inside day after day, and one missing food makes it far worse. Ignore this and the cost is loss of mobility, loss of independence, and a sharp increase in falls, hospital visits, and joint replacements. But today, you'll learn the one food proven to protect aging joints and why doctors now urge seniors to eat it before pain becomes permanent. Let me introduce Dr. Michael Harrington, a board-certified physician specializing in geriatric medicine and inflammatory joint disorders. Over 28 years of clinical experience, treated more than 12,000 patients aged 60 to 85, focuses on non-surgical, nutrition-based joint protection. Dr. Harrington reports that over 70% of his patients experience meaningful joint pain improvement when targeted anti-inflammatory nutrition is added, often within weeks. His conclusion is clear. Most joint damage after 65 is not inevitable. It's nutritional. Here's what happens inside your joints as you age. Your joints rely on cartilage to cushion bones, synovial fluid to lubricate movement, and low inflammation to prevent tissue breakdown. After age 60, inflammatory markers increase, cartilage regeneration slows, and the body produces fewer natural joint lubricants. This creates a perfect storm: more friction, more swelling, and more pain. And inflammation is the real enemy. Chronic inflammation acts like acid on cartilage, slowly eroding joint surfaces until pain becomes constant, even at rest. Mistake number 1, relying on pain medication. Scientific danger. Painkillers mask pain, but do not stop inflammation or cartilage damage. Study insight. Long-term use of common pain relievers is associated with higher joint deterioration and digestive risks in seniors. Patient story. Mary, 72, relied on daily pain medication for knee pain. 2 years later, imaging showed advanced cartilage loss despite controlled pain. Mistake number 2, avoiding fats completely. Scientific danger. Joints require healthy fats to maintain lubrication and reduce inflammation. Data point. Seniors with very low omega-3 intake show significantly higher joint pain scores. Patient story. Robert, 68, avoided fats for heart health. His joints stiffened dramatically until his diet was corrected. Solution segment. The one food. The food? Fatty fish, like salmon, sardines, or mackerel. Scientific benefit. Fatty fish is rich in omega-3 fatty acids, which reduce joint inflammation, protect cartilage cells, improve joint lubrication. Omega-3s actively block inflammatory chemicals that destroy joint tissue. Study data. Clinical studies show seniors consuming omega-3 rich foods 3 times per week experienced up to 30 to 50% reduction in joint pain, improved mobility in 8 to 12 weeks. Some studies show inflammation markers drop in as little as 30 days. Specific action plan. For seniors 65 plus, eat fatty fish 2 to 3 times per week. Portion about the size of your palm. Best choices: salmon, sardines, or mackerel. Avoid deep frying. Bake, grill, or steam instead. Consistency matters more than quantity. If you're finding this helpful, like this video so more seniors see it. Subscribe for evidence-based aging and nutrition guidance. Comment below with your age and where you feel joint pain most. This channel exists for one reason: to help adults 60 and older stay mobile, independent, and pain-free longer. Joint pain does not just take comfort, it takes freedom. It steals morning walks, time with grandchildren, confidence in your own body. But the truth is powerful. Your joints are still responsive to care, even after 65. By feeding your body what it needs, you protect independence, reduce medical costs, avoid unnecessary surgery, and reclaim daily movement. This is not about living longer, it's about living better. Subscribe now, stay informed, and watch our next video on the morning habit that protects joints before breakfast. Your future mobility depends on what you do today.